Next up, Debbie Shaw. I think you're coming up to talk to us about the Children's Services vision for the future.
Good afternoon.
Good afternoon.
Sorry. We don't have a monitor, so it's hard
Get
to from over
it straightened
here.
out before I get started.
There we go. You can use that or the arrow.
Thank you. Like I said, good afternoon. I'm Debbie Shaw, and I am the Interim Assistant Director for Children's Services. And I'm here today to talk about Children's Services Strategic Vision for 2020. Let me get used to my devices here. I want to start with a review of 6 key review findings that have been incorporated into our plan for practice improvement. Oh, I'm sorry. Trying to think which one I can see. I guess I can see that one better. The first key review finding that we're focusing on is really clarifying policies and procedures that impact exigent circumstances. What we're talking about there with Children's Services and child abuse and neglect assessments and investigations is what things what emergency situations will drive us being able to assert ourselves into situations without, well, either with a court order or to get a court order in order to see and interview children. There's some very prescriptive things in law that talks about when we can do that. Another key finding is ensuring that all the household members are interviewed. It's very important as we go into situations to establish who lives in the household and get everyone's point of view in terms of interviewing them about what the allegations are that we've gotten from the community and assessing the family relationships and really heightening the focus on that, not just seeing people, but interviewing and assessing them. Also, we really want to make sure that staff are aware of working with non-cooperative parents. Not everybody is happy to see Children's Services at their door, and we may experience some non-cooperation. So it's very important for staff to understand when we need to elevate those circumstances to conferencing that with our child protection unit to talk about what some of our legal options might be with those cases, and sometimes pursuing a court order to have the family work with us. This one is very important. Being very comprehensive and looking at what the historical records say in regard to a family and their history. Not just focusing on the incident that brought us to their home at that point, but looking back at what is the history of perhaps other open cases or cases that didn't rise to the level of being opened, but that there is information there that kind of informs us that we really need to take a look at what's going on with this family based on a number of referrals. We're working very hard with the prosecutor's office in our child protection unit to collaborate with them and make sure that the legal staff that are representing us are knowledgeable about child abuse and neglect, that we are partnering with them as they're looking at the legal aspects of a case, that we are bringing the child welfare information forward and sharing that and communicating clearly and providing them with all the case information that they need. We've been working with the Child Protection Unit to establish some policies around when we need to elevate cases, and also some communication tools to make sure that they have all of the information that they need when they're advising us on whether we are able to pursue a court order or whether we should make a filing in order to protect a child or children. We're working hard with staff on the Child Abuse Prevention and Treatment Act. You'll also hear that referred to as CAPTA, and that is trying to balance what is parental rights to privacy and not like not being subject to illegal search and seizure, but also with our job that we have to do, which is to protect children. So that's a balancing act, and again, something that we really need to pull our Child Protection Unit into making some of those decisions about when we can make filings in court and how we work with families who are not cooperating with us. Some of the policy revisions and reviews that we're looking at, our red flag policy. We've had a policy by this name, but we want to do some revisions to that and make sure that it clearly spells out for staff what things elevate the case to different points of review. And for example, young mothers who have multiple children and may have a higher level of frustration, or families where there's untreated substance abuse or mental health problems. Reviewing those with supervisors and managers and making sure that we're capturing all of the assessment information and making the plans that we need to move forward. Again, you'll see exigent circumstances where we're looking at more clearly spelling out what constitute exigent circumstances, under what laws we can interview children at school, for example, without parental permission. That again is a real balancing act in terms of how serious the allegations are, and does it rise to a certain level of the law, which again, we will be working with our Child Protection Unit on. Our CAPMAS policy, where we're working on, that's basically all the tools that the state gives counties to evaluate and follow in order to do a thorough assessment of a family and identify their service needs. And I think I've pretty much talked about this in terms of incorporating more language about exigent circumstances, exploring all case history, like I talked about, be it an alternative response case or a traditional response case. In partnering with the prosecutors, we've started meeting with the prosecutor monthly, the supervisor of the Child Protection Unit. We're having monthly meetings where we're problem solving and talking about common issues and how we resolve those to keep kids safe. Again, I think I've hit on this already too. Exigent circumstances, balancing constitutional rights and child protection mandates, making sure that we are maximizing all of our legal options available to us. Doing a lot of training, and I'll get to this in a moment, but we're doing some comprehensive training on the requirement to interview identify and interview all household members, not only for the safety assessment, but the family assessment, which is something that we complete in 45 to 60 days to look at what are the issues, is there abuse and neglect going on, and what do we need to do service-wise to help that family. Do we need to remove children or make a safety plan in order for the kids to be safe? Let's see. Really seeking out documentation on history, child welfare history, that sometimes is in another state, or it may be in another county, which in our SACWA system we're able to access in other counties, but we may not in other states. So we need to thoroughly explore whether there's historical information somewhere else that we need to access. We've elevated number 4 here. We're talking about managers reviewing requests to close cases with high risk scores. When we do a family assessment, there is a matrix that we go through that helps us calculate what the level of risk to this family and the children are. If it's proposed that we're going to close that case even though it has a high risk score, and that would be where there's mitigating factors, that there are protection devices in place, the manager needs to review that. Up until now, the supervisors have been approving those, and so we're making sure that we've elevated that to another level of review to make sure that we should be closing cases. again, talking about how to handle non-cooperative parties, working with the child protection unit on that, and also doing training. Requiring external verification of case plan progress when we have an open case and we're talking with families, or we have an intake. Perhaps it's not an open case yet. Not just relying on the, for example, parents or caregivers to tell us what they've done, but actually, communicating with the provider and getting verification that indeed they've completed services and they're able to demonstrate that they can protect the children. I mentioned this a little bit. This is a really important piece of what we're doing, enhanced skills training. What we're doing is incorporating everything that's in our plan for practice advancement, the local and state reviews that we've had, and we've designed a multi-level training program that will train our supervisors in working with caseworkers and overseeing the work, also train our caseworkers like in separate sessions, and then bring them together to work on critical thinking skills and what are best practices and the rules that we need to follow, and that we can become consistent across all of our areas and how we practice. We're in the process of, we've actually updated our memo of understanding on child abuse and neglect to include schools, law enforcement, other mandated reporters. And in the next, I believe, 30 days, we do have meetings set up with other agencies and mandated reporters to review the memo of understanding and sign that and get their feedback. And again, improving the collaboration with the prosecutor's office. Now I want to invite Jane up. Jane Hay, I think most of you know Jane, president of PGO. We want to talk about this slide because it's really kind of been a partnership. And
right, exactly.
Yeah.
So I just had a few words. Good afternoon, everyone.
Good afternoon.
So partnering, moving forward with the county and the agency, and with this new reorganization, having the caseworkers focus on only one duty, intake or ongoing, that provides a direct benefit to our clients. This means that workers will have more time to focus on their area expertise when working with families. Thanks to the county administrator, Michael Colbert, for keeping his promise made during negotiations. The vacant casework positions are being posted and filled. This will bring down caseload numbers in the near future, which decreases the risk to our children and families that we serve. So that's a big win for everybody. Along with the reorganization, the governor's recommendations, and new safety and accountability measures put into place, this will go a long way to keeping kids safe, and that's what we all want. So we're looking forward to the new partnership and collaboration with the agency and the county. So, thank you.
So yeah, we're
Thank you, Jane.
really excited about this reorganization that we're doing, and I'll just kind of conclude by talking a little bit about this. Like Jane said, really took a look at specializing, having caseworkers specialize in particular areas. Typically we have like intake and assessment workers, and we have ongoing workers, and we've had them all kind of under like a supervisor in a unit, and we've decided that we really need to separate them out into intake units where that's their focus, and we do intensive training with them, and they can focus on that beginning part of a case and making sure that we do that comprehensive assessment and looking at the historical information, and really work hard on that, while we have ongoing caseworkers who can focus on the cases that we open and the whole service delivery piece. And that way we can keep cases moving through our intake departments. If we open them up, we'll transfer them to ongoing, and then they'll be able to focus on that area of specialty. So that's something the staff's really wanted, and we've worked with the union about. Also addresses budgetary concerns. really work at orienting new employees, and we're also working on developing another department within Children's Services that's going to focus on, and we're very excited about this, diversity, equity, inclusion, and they will also be focusing on quality and outcomes. Okay.
Well, Debbie, I just want to tell you and your leadership team, thank you so much. I also want to say thank you, Jane, to you and PGO and the entire leadership of the union. This could not happen without you bringing it forth, and for our county commissioners who really asked us to think differently and to move the agency forward for our children. So thank you, commissioners, for giving us the will to do this. And Debbie, great leadership, and Jane, the input that you and the team gave us on both the reorganization and on some of the specialization. As we look at intake, as we look at case management, as we look at having quality assurance, that doesn't happen without your input. So again, thank you for your support. Commissioners?
I was just going to say, thank you both for all the hard work that you put to make this, and I know it's going to be very successful. We really appreciate it. And I know that we've had several discussions over this reorganization. So again, it's another significant step in the creation of a new position, a manager of community and client outcomes. So that is a very positive step right there. And this person will report directly to our new Assistant Director for Children's Services, and this manager will oversee 5 supervisors and staff who will look at client outcomes with an emphasis on the impact of implicit bias that can impact families in the child welfare system. So again, thank you very much, and I'm looking forward to working with you as time goes on. Anybody else?
I just want to add that, we know that you all have been working on this for months, and we really appreciate it, and it makes sense. And, people may say, well, what took so long? Well, we know the day-to-day work that you guys already have is overwhelming. And so the fact that you were able to really dig in and figure out what are the best practices and what are we doing right and what can we improve on, I really applaud you. And you did this while we were having to go through the review by the Ohio Department of Job and Family Services and with the alternative response case review. So we know how hard you all have been working, and I know it hasn't been easy, especially with the special review about Dakota's death. So I know you all were very positive and you welcomed the input, and we really appreciate that. And I just appreciate you working together, and we look forward to continuing to work with you, Jane, and your team and your union. And again, thank you. I'm so glad that we had great negotiations, and it's, I feel really good about where you all are right now. So thank you.
And I would just echo that, I believe all of us truly understand and appreciate that caseworkers have very difficult jobs. And they need to be empowered to use their instinct, their training, and all the resources available in the protection of our children. And I truly think that the enhanced training piece and regular meetings with the Child Protection Unit should really make a difference with the Children's Services staff. I think that'll be a real improvement. And knowing when to elevate those cases is so incredibly critical, so that our staff needs that legal input. And so it's truly a partnership in making these decisions that are very difficult decisions. And now they're meeting regularly with Child Protection Unit so that they can get that legal input. One less barrier, a stronger collaboration, which is good for everyone involved, and especially the children. I know that many in the general public do not fully understand that caseworkers need to work very closely with law enforcement and the court to accomplish what is needed for children. Parents have legal rights as well. That is for sure. And if a caseworker wants to interview a child without parental consent, the caseworker will need legal grounds to do so. So I think you said it over and over, but what you've been describing to us, it's a very difficult and delicate balancing act. And I know all of us here on the commission, as well as the leadership team and everybody in the county, truly appreciate what our child welfare caseworkers do every day. We can't say it enough, and we are grateful that the negotiation is behind us and we're moving together in a very positive direction. So thank you for all you do, and I look forward to a brighter future for our children and families and our community.
I'd also like to add, Commissioners, that some of the changes that have come forth, Debbie and Jane have been working on in the teams, our employees, are actually going to be statewide changes. The changes that they are recommending to the SACWIS system, which is the case management system to track child welfare activities. Those screen changes are statewide, and our JFS director, Michelle Niedermeyer, is here. She is championing this at the state level. So from the work that will be done here, we're hopeful that we'll be able to move the system, not just in Montgomery County, but across the state.
Thank you. Okay, good. Thank you again.